Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Tuesday, October 6th, and this is our COVID briefing. We've had 1,132 cumulative positive cases in Missoula County to date, with 52 new cases since yesterday. We've had 719 recoveries and 4 deaths. Our deepest condolences go out to the family and friends and loved ones of our most recent county resident who has passed away from complications with COVID-19. 4 Missoula County residents and 5 non-county residents are currently hospitalized in Missoula County, and we now have 410 active COVID-19 cases, and we've currently identified over 1,000 close contacts. Those active cases and their close contacts remain in isolation and quarantine and are being supported as needed. The state of Montana is reporting 15,347 cumulative COVID cases, which is up 504 new cases from yesterday. There are now 4,983 active cases with 216 active hospitalizations across the state. There have been 192 deaths related to COVID-19 statewide. The University of Montana has had 192 cumulative UM-associated cases since the beginning of fall semester, up 10 since yesterday, and there are currently 100 active cases associated with the University of Montana. As I discussed last week, the CDC recently released a report showing that when you see a jump in the number of cases in people in their 20s, you may begin to see an increase in other age groups, particularly in those over 60. We're now beginning to see that shift in the age groups that are becoming infected. The percent of those in their 20s is going down, and the percent of those in their 30s and over is going up. So we are going to continue to monitor and report on this trend. Our new website is up and running. You can check it out at missoulainfo.com. The information there should be easier to locate and navigate. You can still submit comment through the resident feedback portal that's on the main landing page, and our most current data is located under the Data tab. I want to again let you know that with the significant spike in the number of cases coming in, our team is working as quickly as possible to do case investigation and contact tracing. I know that there are many people out there who are still waiting to hear from our team. If you tested positive for COVID-19 and have not yet heard from our team, you could help us speed up the process by compiling a list of names and phone numbers of anyone that would be considered a close contact to you. So just a reminder, that would be anyone who was within 6 feet of you for 15 minutes or more, and that's cumulative minutes, so 5 minutes 3 separate times still is 15 minutes, and that's from 2 days before you develop symptoms until you isolate yourself from other people. Having that list ready when our staff reach out to you could save significant time and resources and would allow our team to complete the case investigation and contact tracing much more rapidly. Also, again, it's really helpful if you answer your phone when our team calls you. The phone number will come from a 406 area code, with the prefix being either an 830 or a 550 prefix. So thanks for your cooperation in helping us get through all of these new cases. The last thing that I want to announce is that we are increasing our enforcement activities to assure that bar and dining establishments where people socialize are abiding by the governor's Phase 2 restrictions and the local health officer orders in order to slow the spread of COVID-19. Since the onset of the pandemic in March, our enforcement team has responded to hundreds of complaints about violations to COVID-19 restrictions in public places, including the local and state face covering rules. In light of this sharp increase in cases, especially among the 20 to 29-year-olds across the state, including here in Missoula County, the health department is transitioning from only complaint-focused enforcement to adding unannounced inspections. Over the past week, including weekend and evening hours, environmental health specialists have completed inspections at bars, casinos, breweries, and dining establishments. While the majority of those locations were in good compliance with distancing, occupancy, and face covering requirements, several establishments were issued warning letters. Failure to comply with COVID-19 restrictions may result in further restrictions, closures, or referral to prosecution based on upcoming follow-up inspections. Unannounced inspections at these types of gathering places will continue to be conducted during high business hours as a control method to slow the current COVID-19 spike. When cases began spiking a few weeks ago, about half of the active cases were in those 20 to 29-year-olds. This age group tends to work frontline in restaurants and retail establishments, and they also visit many of them as customers too. Our team wants to extend its appreciation to the majority of the establishments and patrons where those inspections showed good compliance, demonstrating how businesses can remain open and with safety measures in place, and the public can continue supporting local businesses while following the local and state health and safety rules. So that's it for today. As always, you can subscribe to me on YouTube under my name. That's Cindy Farr. It's CindyFarr. Click that notification bell so you get notified when additional videos are uploaded. You can check out our new webpage at MissoulaInfo.com. You can follow us on Facebook for all kinds of information there, and you can call 258-INFO if you'd like to schedule a test for COVID-19 or you have questions about COVID-19. So until tomorrow, everybody, stay healthy.